Hello, folks. I'm the old sergeant. The Wuhan coronavirus continues to be a worldwide economic and health threat. Here is the recent information I have consolidated. As we cannot trust the Chinese government's data and reports, we can only go with the best open source intelligence we have. The virus's current threat factors. It is airborne, which means that in hospitals, it can circulate through the vents and infect other people, same way as on cruise ships. The incubation period is up to 24 days. It is killing people of any age and health range. The primary victims are the elderly, along with smokers, people with diabetes, heart disease, asthma. 60% are men. Ocular transmission. It can be caught through the eyes. Recovered patients can be reinfected. No antibodies against the virus are created, which calls into question the ability to make a vaccine. Surface transmission. 9-day survival time for the virus on surfaces. Survives hot humid climates as well as cold and dry. 20 times more likely than SARS to bind to human cells. Its current R0 value is 2.3. R0 is the average number of people who will catch the disease from a single infected person in a population that has never seen the disease before. If R0 is 3, then on average, every case will create 3 new cases. The numbers are being manipulated by politics rather than science. The R0 value could be a lot higher. To compare, seasonal flu has an R0 value of around 1.3. HIV has R0 of 2 to 5, and measles has an R0 value of 12 to 16. Current reports. The current numbers, as reported by China and Johns Hopkins, is 75,778 are infected, with 2,130 deaths. These numbers are way below reality. One hospital on the outskirts of Wuhan reports more deaths in that hospital alone than the total reported. Even if the Chinese government was not trying to hide the real numbers, there's just too few medical personnel and test kits to adequately diagnose and treat the infected. The system is completely overwhelmed. In secretive talks with the World Health Organization, Google, Amazon, and Facebook are reported to suppress reports, as they are called misinformation. China refusing to turn over information about the Wuhan biolab. The virus did not start in the food market as earlier reported. China refuses to allow American scientists to invest the source as more and more investigative reports point to the Wuhan biolab. The director of the Wuhan hospital, 51, dies of the coronavirus. Unrecovered bodies are lying on the ground all over Wuhan. 99 more passengers on the cruise ship Diamond Princess in Japan. Now, 454 passengers are infected. Started with one person. Countries have started to remove their nationals from the ship. Harvard says 60 to 89% of coronavirus cases are currently undetected in all countries outside China. Heathrow Hotel closed to public and guests removed after health officials designated it as a quarantine center for the infected. Flights from China to America continue despite reports the flights from China have been stopped. Chinese doctors are overwhelmed, under-equipped, and exhausted. Some have been physically attacked by grieving family members. 1,716 Chinese medical personnel have been infected. Washington State is monitoring 712 people with coronavirus symptoms. Reinfected patients are dying of heart attacks in mid-stride. 760 million people in China are currently under quarantine. People with no connection to China have now been infected. Global supply chains drastically affected as companies are short-staffed and short of supplies to continue production. Japan starting to cancel mass gathering events. The Chinese are boiling the cash to kill the virus. The government is destroying currency. Action plan. As always, stock up on supplies you think you will need if you have to hunker down in your house under self-quarantine for a long period of time. A perspective. How strange it would be if the worldwide economic disaster caused by the virus were to lead to the collapse of communism in China, but have the Americans vote in communists. I am the old sergeant. Stay informed, stay active, stay prepared, stay vigilant.